Hi there, I'm Dr. Kimberly Kolkhorst, gastroenterologist with Essentia Health. I always kind of liked medicine, but what really solidified it for me, I did a master's degree over in Boston University, and for my research project I was working with the Framingham Heart Study, which is a large research cohort study, and I got involved in stroke patients. And I had to go into the hospital and do physical exams on them, and then I would see them, in 3 months, and then in 6 months, and then continue to do physical exams and see what kind of deficits they had, and got involved with patients and their family members, and I just loved it, the exposure in the hospital. And I said, this is what I want to do. I really enjoy working with patients and helping them through tough times in their lives and help them cope. People ask me that all the time. They're like, you do gastroenterology? You're doing colonoscopies? And so my father actually had liver disease, and he died from liver disease. So at a young age, I was exposed to gastroenterology, and I always wanted to understand more about it. In fact, his physician was a female gastroenterologist, so she was kind of a role model for me. But then, I went to medical school with an open mind, and I said, let me learn about other fields and let me see what else there is. But I always went back to GI. And I think it's because not only is there that passion there from childhood, but then also I like the combination where you can do procedures, then I can do inpatient consults, and then I do outpatient clinics. So it's a nice balance. And the other thing I noticed is that gastroenterologists are always happy people. So I said, that's a good field for me. I love it when my patients feel comfortable with me. That's really a big thing. When you go to see a physician, sometimes, it's stressful. You have to kind of come out and, talk about things that you might not feel comfortable talking to a stranger about. But, I really enjoy it when a patient feels like, and I try to make them feel more comfortable around me, that they can open up and then tell me really what's been going on, be open and honest about everything. And if you're drinking alcohol, I want to know about it. If you told someone you quit smoking, but really you are still smoking, I really enjoy it when my patients are open and honest with me, because I truly believe that medicine is a partnership, and so if we can work together, then we can have a better outcome for your overall health. A lot of it is lifestyle, so I find that I'm telling them a lot, it comes down to eating well, exercising, making the right choices in life, and making sure that you continue to follow up, and especially with colonoscopies, making sure you're getting your screening colonoscopies, and so we can help prevent you from ever getting colon cancer. I like to go to the gym and work out. I like to go running. I like traveling whenever I get time to go traveling, and then just spending time with friends and family. I also enjoy reading and photography too. So.